Quadratus lumborum is a very, very active muscle. It's a very important muscle in stability. We're using it all the time. It's actually one of the deepest abdominal muscles, although it's often thought of as a back muscle, simply because it's at the back, but it's very, very deep inside. The pain in the quadratus lumborum is quite diverse. It can cause pain in your hip joints, your buttocks, your thighs, your sacroiliac joint, low back pain, and even abdominal pain. So it's quite a naughty little muscle. It can cause pain basically from here down here and into here. And I honestly use needle quadratus lumborum regularly, at least 2 or 3 times a day with my patient load, and often have quite a lot of success by needling that in the erectus spinae with decreasing low back pain. Basically, if I just get the patient to hitch their hip up, and you can sort of localize or feel the muscle, and even get there sometimes to put their arm above their head, and you can feel it going, things working there. You can go through the erectus spinae. Probably it's better to just come in a little bit to the side. Now, in the diagrams, they've got from sort of medial to lateral, which it kind of makes sense, but it's quite hard to do that. So sometimes if you just come in, you find the trigger point with your fingers, stretch the tissues out, place the needle in the area, and then tap, or how I would do it is just kind of stretching it out there. Once I've found it, tap the needle in. I come in from medial to lateral. Sometimes I do go in a posterior anterior direction. And often I will have to work around this area to do a number of trigger points before moving on. So that's the needling for quadratus lumborum. Prior to that, we were doing erectus spinae. Often when you're doing quadratus lumborum, you will get some of the lower lumbar parts of the erectus spinae as well.
If you found this video useful and want to see more like this, make sure you subscribe below and don't forget to hit the notification bell.